Antibiotics, we're wonderful pills, but don't ever think we'll cure all of your ills.
Limiting the amount of antibiotics we take to make sure we don't become resistant to them is something the GHA has been trying to encourage for years. But antimicrobial resistance is a growing concern globally. In overseas territories, issues like limited resources and the repatriation of patients can contribute to our resistance. The conference aims to get OTs talking about the surveillance of this issue. Locally, we use lab testing to do this.
Geographically, as you know, we have about 20,000 people who come in from neighbouring Spain, so in a way it's not surprising that our antimicrobial resistance patterns are perhaps a little bit more aligned to our local geographic neighbours than perhaps, say, other parts of more northern Europe. I would say, on the whole, we are aligned to, as we would expect, to other southern European countries in terms of our antimicrobial resistance for some organisms. I say Streptococcus pneumoniae, which is the most common cause of bacterial pneumonia, is more aligned to perhaps the Spanish resistance rates. In other respects, such as organisms such as E.coli, which is a very common cause of UTI, where perhaps have slightly lower resistance rates at times than some of the neighbouring southern European countries, and that's something that we're trying to analyse and track and safeguard as well.
Dr. Cortés says resistance to E. coli could reflect repatriation measures on the rock or prescribing practices. The aim of the conference is to learn from the way other OTs approach antimicrobial resistance.
We identified some learning needs in this space, mainly around antimicrobial resistance surveillance and epidemiology, and we decided to develop this program for them. It's a one-off training activity. The resources we developed were developed jointly with the UK Field Epidemiology Training Programme, and they will be provided to the participants to take home to their respective territories and share with the rest of the workforce.
The OTs are particularly at risk because they are small, vulnerable communities isolated from the rest of the world, and they're particularly at risk from importation of infection as well, including antibiotic resistance. So we've been working over the last few years with all the OTs in trying to improve detection of antibiotic resistance in the OTs, and now we're looking at surveillance.
Patients in Gibraltar will go to external hospitals, be it in Spain, be it in the UK or elsewhere, and obviously within those centres they may become exposed to resistant organisms that they may then bring back with them to our hospitals and our settings. So that is why we have that risk, and the same risk applies to a certain extent to the other UCOTs, and that's why we take those measures that we do take in place in terms of making sure when a patient has been repatriated that we isolate and test them for any resistant organisms to check they've not brought back anything with them.
At present, there is a push to use more targeted antibiotics at the GHA.
There are some antibiotics that we've relied on for many years. So if you take penicillin, so that its value is being threatened in some cases by overuse. You may have heard of other antibiotics that are slightly more broad spectrum, so the other terms for them that we knew are augmentin or zinat, which are used a lot more. Those are slightly broader spectrum antibiotics, and they have a more wide-ranging impact on an individual's microbiome, and what they can do is select out for more resistant strains. That means that we end up running out of the options that we would ordinarily have used to treat an infection, and then in some settings you're left only with intravenous antibiotics, needing the patient to be admitted to hospital, or in rare instances that we don't want to get to is having no antibiotics.
Tackling antimicrobial resistance requires action from clinicians but also from patients.
Remember that antibiotics are a prescription-only medicine, and they shouldn't be something that can be purchased through any other route or exchanged between those, between family members or friends.
Really think about whether you need an antibiotic prescription.
The goal is a common one: preserving effective medicines.